Hi class, today I'm going to speak with you a little bit about fertility, particularly ovulation. When I'm referring to fertility, what I'm really talking about is when couples say that they are trying to have a baby, other than the obvious activity that comes to mind, here are some methods that they may be trying at home. In addition to achieving pregnancy, this information can also be used to avoid pregnancy. However, it should be highly noted here, this is not a reliable source of birth control. It would be good to be using this with a barrier method or hormonal method, just to know when the most dangerous, high-risk times to become pregnant are. Okay, a couple can begin trying to conceive directly after going off birth control. It is safe, although it may take the woman a few months to calibrate from the hormones she was taking before, if she was on the pill or something like that. Most couples achieve pregnancy within 6 months of trying, although some can get pregnant right away. 6 months seem to be the closest average. About 75% of couples achieve. After 1 year, that number declines, and some couples may choose to go to a physician to seek testing or possibly assisted conception, although many just continue to try after that.
One way that a woman can predict her ovulation is by using the calendar method. Many women use phone apps that make this process very easy compared to the old paper method. For sake of example, I used a typical 28-day monthly cycle. Though the length of a woman's cycle often varies, the idea is to get an average over months of charting to better predict ovulation. She would start with charting the days of her period, shown here in red X's. I made this one an average 5-day menstrual cycle. She should then count 14 days from day 1 of her period as her predicted ovulation date. It's shown here with a starred F as the most fertile day. The 5 days before ovulation are also considered part of the fertile window, as her egg could be released at any time and be ready for 24 to 48 hours. And since we know sperm can live for up to 5 days, this whole 6-day window, including a few days after, would be the preferred time to conceive. This would also be the most dangerous time to have sex if you are not trying to become pregnant. Physicians recommend couples having sex every other day during the 6-day window, including a few days around it, to increase their chances of conception. Those sex days are shown here with orange hearts. A woman can also chart her basal body temperature to help predict her ovulation. She would take and record her temperature every day at the same time, preferably when she first wakes up. A woman's temperature drops slightly just before ovulation and then spikes just after. This special thermometer measures in tenths of degrees, which can show the subtle change. Thanks to modern science, many couples now can also rely on ovulation predictor kits, which potentially cut out a lot of this hard work mentioned already. Working much like a pregnancy test, the woman urinates on a test stick, and if the luteinizing hormone is present in her urine, the test will be positive, and sex within the next 24 to 48 hours could mean conception if timed properly.
Finally, it just wouldn't be a party if we didn't at least mention cervical mucus. Without going into too much detail, this terrible sounding term simply refers to the amount of fluid a woman has going on downstairs during different parts of her cycle. Basically, the more fluid, the more fertile. Please keep in mind that any of these mentioned predictors can be affected by a woman's health, her hydration level, her stress level, substance use, or previously existing conditions. And just because a woman may not ovulate regularly, it does not mean she's necessarily infertile. Both men and women have varied causes for problems conceiving, and 1 in 6 couples deals with infertility. In conclusion, is this the only way for couples to have a baby? Heck no! This is just the most widely studied and old-fashioned method for conceiving. Assisted conception methods are out there and becoming more and more successful for every kind of couple wanting to start a family.